Hello everyone. Today I'm going to share about sensitivity. I've been meeting different people coming in. Someone comes up late. When I take ice cream, I get paid. When I take cold water, I get paid. When I eat something hot, tea, I get pain. But what it can cause such pain? And I know very many of you are there just because pain comes on and off, so you've not yet come to me. But you're there having this. So today I want us to share about what could possibly cause the sensitive teeth, sensitivity in teeth. You take something too cold, you get that pinch of pain and you hit your cheek, yes. And maybe you're brushing and you feel there are some spots where you pass your brush and you feel sensitivity, or when you put that water to rinse, you feel that sensitivity. Basically, there are quite a number of causes, of which the first cause is the decay, tooth decay. When your tooth is getting a hole, or when your teeth gets holes, they become sensitive. How? They expose the dentine, the second layer of the tooth, and in that way, the dentine sends messages to the nerve to the brain. So whenever something cold changes in temperature hit that spot, you feel sensitivity. Two, fractures. Tooth fracture, or you can say breaking of a tooth. For example, you're a wonderful wife and your husband gives you a kick, you fall on the door and the tooth fractures, breaks or chips. It is literally exposing a dentine. Maybe it's a road traffic accident, and when you get an accident, your tooth breaks. That is called a tooth fracture. And such fractures can also result into sensitivity. Another cause, which is very common, is worn out feelings. Like you come, we do a dental feeling, and we tell you it's a permanent cement, and you go, you even forget to come for checkups. It's 5 years, 10 years, 20 years, and this feeling has started chipping off. Some small fragments are breaking. So, as they are breaking, you get an exposed dentine and your tooth gets sensitivity. So if your feeling has stayed for so long and it is beginning to break or to chip off, it can also result into a sensitive tooth. Then we also have something that is very, very, very common, and that is a gum disease. You know, gums also get sick, and we discussed about this some time back, where you get your itching gums, your bleeding gums. When you brush, you see blood. So when your gums are sick, you feel the sensitivity, and in most cases, when gums are sick, you come telling us your teeth are sick. So also gum disease can cause that. And another one is worn tooth enamel. Sometimes we discussed this, the structure of the tooth. Enamel is the topmost layer of your tooth. So if this topmost layer is erased, or you can say tooth erosion, you remember that in agriculture, soil erosion. So the topmost layer wears off, it is exposing the dentine, and this dentine is sensitive, and in that way, your teeth begin feeling sensitivity. Sometimes it is unexposed root. By the way, I've seen very many patients who come and you have the gum is worn off, the root is exposed, that yellowish part of the tooth is exposed. That one is an exposed root. Causes of exposure of roots most probably is gum disease, and two, poor brushing habits. Yes, if you're brushing using too hard brush, the brush with too hard bristles, you will erode your gum and you expose the root and your teeth will be sensitive. And if you're using too much force, you are scrubbing as if you're scrubbing your floor at home. This is your mouth, and the reason we brush is simply to remove food that we have eaten. So it is really soft food. It deserves a gentle brush, and in that way, you'll be clean. But what can be done if you have sensitive teeth? How can you be helped? One, we can use what we call desensitizing toothpastes. Very many of you know the so-called Sensodyne. However, this treatment is identified depending on what is the cause. If it is a fracture, don't look for Sensodyne. You will not be helped. If it is a tooth decay, don't look for fluoride gel. You will not be helped. So it depends on what is causing the sensitivity. That's why you still have to come to a dentist, get your best dentist. If you don't have one, you can pick me. Next one, Royal Dental Services, and we help you. So we can prescribe sensitizing toothpaste. We can prescribe fluoride gel just to enhance the strength of your enamel. We can do crowning if maybe your enamel is worn out and your tooth has exposed daytime. You can crown, or if it was a fracture and maybe more than half of your crown is broken, you can put a crown. I'll take you through crowning one time. Maybe you can put for them that video in a small thing up there, they see what crowning is. We can also do surgical gum grafting. If your gum has recessed, we can get a way of pulling your gum up to cover the root completely. Maybe we can opt for a root canal treatment where we remove the sensitive part of the tooth and your tooth remains in normal functioning normally with no pain. Thank you very much for being with us, and thank you very much for choosing Royal Dental Services. We are here to serve.